Are dissolvable inner stitches supposed to be there 1 month post-op and above the crease line? Asian eyelid surgery. I'm 1 month post-op and the dissolvable inner stitches are quite prominent and raised and are above my crease line, especially on my right eye. Is this to be expected, and are the dissolvable inner stitches supposed to be above the crease line? I don't live in the same state as my cosmetic surgeon, so I'm really hoping this is normal and will resolve itself.
Thank you for your question. You submitted a single photo with a question about whether or not it's normal to have thickening of the incision line 1 month after surgery, secondary or caused by, as you described, dissolving stitches. And you describe in your question that you live in a different state from the cosmetic surgeon who performed the surgery. Well, I can give you some guidance as to how to interpret this situation. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial, plastic, and reconstructive surgeon, practicing in Manhattan and Long Island for over 20 years. And Asian eyelid surgery is an area of focus in my practice, an area of expertise. So I can certainly give you some guidance based on just this single photo. So what do we see? We see an incision line, and we see an area of the inner aspect of the incision line that's thickened, and it's 1 month after surgery. Well, clearly this was an incisional Asian eyelids operation, and the question that I would have is, were there non-dissolving sutures, and were those non-dissolving sutures removed about a week later? Or was the plan that you would have nothing but dissolving sutures since you were not from the area, and that the dissolving sutures would dissolve on their own? Now this is an important distinction, and in addition, whether or not your surgeon felt it necessary to engage the inner part of your eyelid with deeper stitches that are placed to connect the skin to a muscle called levator muscle. You see, whether you do the procedure as a non-incisional or an incisional Asian eyelid surgery, your goal is to, in order to define the crease and to create some long-term connection between the skin and the levator muscle. And this is the muscle that lifts the eyelid and defines the crease. Now, use of dissolving stitches to engage the skin to the upper level of the tarsus, the backbone of the eyelid, as well as the levator muscle, is something that is done. Now, the type of stitches can be something called a plain gut suture, or it can be another suture called a vicryl suture. Now, these sutures dissolve at different rates, and certainly they can create some bumpiness and some irregularities. When you think about wound healing, the first month of wound healing is referred to as the proliferative phase. The body is generating a lot of collagen, blood supply. It's a very active production and healing process. Now, if this were just the incision alone, then I would say that most likely it'll flatten out and smooth out, because that's what happens with any incision. But the fact that you had stitches that were dissolving, I am not sure, based on the photo, whether those dissolving stitches are responsible for the thickening or whether it's just normal wound healing. A lot of times, like for ourselves, there's a pattern of practice that every doctor has, and the experience that comes from doing that practice. So if your doctor uses dissolving stitches routinely, then they should probably be familiar with how someone responds during the first month, second, third, fourth, and beyond. So, although I could say, yes, it's possible that it's from the dissolving stitches and that it is likely to improve, since I don't know more details, I think it is still important that you communicate with your doctor and ask about this situation, this incision. Because your doctor most likely has a process, especially for people who come from out of town, just as we do. A lot of our patients come from around the world for eyelid surgery, for facelifting surgery, for hair loss treatment. I mean, there's a lot of reasons to travel. But with all of those procedures that we do, we have a process and a system and a familiarity of what to expect after the treatment. So I think the same should apply for the doctor who performed your surgery. So speak to your doctor, send the pictures, keep that communication going. It's only been a month since the surgery, and although you are looking for additional opinions, I don't think anyone can give you as clear of an understanding as the doctor who originally performed the surgery. So I hope that was helpful. I wish you the best of luck. Thank you for your question.